Scopic ones. Hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And your biceps tendons to the left. Hand me something like a probe or one of the gold ones. Either one. And remember, we talked about your biceps being torn at the anchor site, and here it is. Okay, see that? That is a kind of a degenerative type 2 slap lesion there. Doesn't always cause symptoms, but when it does, it can be kind of a bear to get people back to where their shoulder doesn't hurt, because it can affect all of your overhead activities, and that's actually what it's done for you. And so we're going to get that fixed with the biceps tenodesis today. I just wanted to demonstrate that problem here. Yeah, a little bit of bleeding. We'll stop that a little bit. But I just wanted to give you a good demonstration of this type 2 slap lesion. So your rotator cuff tendon up above here actually looks pretty good so far. We know there's a partial tear in it. We know it's about a 50% partial tear. And we're going to mark the area where it is, which is basically right here. Before we do that, we're going to look around the rest of the shoulder. So as we look down at the glenoid towards the bottom of your shoulder, this looks good. Here's the humeral head above. That cartilage looks good. In terms of the anterior capsular ligaments, this is the middle glenohumeral ligament. You can see how when it's this thin, you can basically see through it. And then down below that is going to be the inferior glenohumeral ligament. Lift up on the shoulder for me, see if that makes a difference. Yeah. And we can see these folds in the capsule right here. Looks good. So the next step is for us to take a pair of arthroscopic scissors. We're going to release this biceps. Whatever you got, whatever. I'm trying. Yeah. We're going to release this biceps and do that subpectoral tenodesis kind of after we do any work in the subacromial space. But here's our pair of scissors. And now the biceps is released. We're going to take our shaver. Give me a little more slack on that, just a little bit. Oh, yeah, we'll get that. And we'll just clean up the labrum a little bit here. It doesn't take much now that the biceps is released. We'll show you some more in a little bit. Okay, so here's the partial tear in the cuff. We know this from the MRI scan. We're going to pass that spinal needle through it, and then we're going to take hold the camera, please. We're going to take a purple suture. It's an absorbable suture, but we're not going to leave it in anyway. This is just a marker stitch. It's called a PDS. I like it because it's purple. It's easy to find when we change positions with your shoulder. There it is there. And so the trick here is we're just going to feed a bunch of it in. And then once we get it in, we're going to back out the needle. And now we'll take a pair of regular Mayo scissors and go off on the video and show you some more from the subacromial space in just a minute. Okay, so we're in the subacromial space. This is the acromion at the top of the screen. We've already smoothed out the anterior edge of it, so you can see the freshly cut edge there. Your clavicle is over here, and I don't think we're going to have to do much to that. We'll decide a little bit later, but I just want to show you that's your clavicle right there. That's the AC joint. Now, as we look over here towards the front of the shoulder, we're going to get a good look at the rotator cuff now. And remember, we placed that marker stitch to kind of help us decide if this tear is worthy of repair. This is the anterior portion of the supraspinatus right here. That's way in the front, and that looks great. As we look down at that, now we'll rotate slowly internally. And as we do that, you can see the marker stitch, and so far so good, right? I don't really see any major defects. I'll tell you, I'm going to go ahead and pull the marker stitch now that we know where it is. And as we work back here, all the way to the posterior cuff, and then we'll slowly come back the other way again. I'll tell you what, this looks like pretty good news to me. I don't see a reason to take down that tendon. Of course, we got the biceps tendon to deal with, but I don't see a reason to take down the rotator cuff. So we're going to finish up here shortly in the subacromial space and get to work on the biceps tenodesis in just a minute. This will be the end of the video, so I really think this will do the trick for us. It's a little bit less surgery than we were ready to do, so that's a good thing. Bye-bye now.